Hemochromatosis. What is hemochromatosis? Hemochromatosis is a disorder in which extra iron builds up in the body to harmful levels. Iron is an important component. Iron has a synthetic effect. Hemoglobin, the substance that transports oxygen to cells in the body. And myoglobin, the substance that stores oxygen for the body. Uses of iron. Iron is important for making red blood cells. Transport of oxygen and CO2 during respiration, hemoglobin. Storage of oxygen for muscles, myoglobin. Electron transporter, cytochrome, mitochondrial dehydrogenase. Cellular respiration, catalase, peroxidase. Involved in the composition of an enzyme in the immune system. Iron is also a component of several important enzymes. Iron plays an important role in brain development in children. Iron deficiency will cause iron deficiency anemia and affect cell metabolism due to deficiency of iron-containing enzymes. However, too much iron is harmful. When the body is overloaded with iron, it will cause iron accumulation in tissues, such as the heart, liver, endocrine glands, etc., leading to serious dysfunction of these organs. If left untreated, hemochromatosis can cause iron overload, an accumulation of iron that can harm many parts of the body, including the liver, heart, pancreas, endocrine glands, and joints. Types of hemochromatosis. Primary hemochromatosis, also called hereditary or inherited hemochromatosis, is caused by an inherited mutation in the genes that control how much iron is absorbed from the diet. Secondary hemochromatosis, also called secondary iron overload or hemosiderosis, is caused by too much iron in the diet or too much iron from blood transfusions, such as blood transfusions to treat severe anemia. Neonatal hemochromatosis is a very rare condition caused by damage to the fetal liver in the womb. This liver damage causes extra iron to build up in the liver and other organs. Common forms of hemochromatosis. The most common forms of hemochromatosis are caused by mutations in a gene called HFE. The HFE mutation commonly causes a hemochromatosis known as C282Y. Another HFE mutation that can lead to iron overload is called H63D. People with 2 copies of C282Y are more likely to have iron overload. People with 1 copy of H63D and 1 copy of C282Y can also develop iron overload, but this is less common and usually less severe. About 1 in 15 people with Nordic ancestry has at least 1 copy of the C282Y mutation in the HFE gene. This means that about 1 out of 225 people in this population have 2 copies of the gene and are at risk of developing hemochromatosis. Primary hemochromatosis is less common in people of Asian or African ancestry, because the C282Y gene mutation is less common in these populations. Who is more likely to have hemochromatosis? Caucasians are more likely to develop hemochromatosis than other groups, because the C282Y gene mutation is most common in this population. Men and women are equally at risk of developing the C282Y mutation, but men are more likely to develop iron overload and the symptoms and complications of hemochromatosis. In people with these mutations, it can take decades for iron to build up to harmful levels. Symptoms usually do not develop before age 40. On average, women develop symptoms about 10 years later than men. Often after menopause reduces iron levels in women. Among people with the C282Y mutation, lifestyle factors and health problems can also increase the risk of severe iron overload and symptoms and complications of hemochromatosis, including other chronic liver diseases, especially chronic hepatitis C. Drink a lot of alcohol, be addicted to alcohol. Complications of hemochromatosis. If left untreated, hemochromatosis can lead to iron overload and complications in the liver and other parts of the body. Cirrhosis. In cirrhosis, scar tissue replaces healthy liver tissue and prevents your liver from working properly. Scar tissue also partially blocks the flow of blood through the liver. As cirrhosis gets worse, the liver begins to fail. Liver failure. Cirrhosis can eventually lead to liver failure, also known as end-stage liver disease. With liver failure, your liver is severely damaged and stops working. People with liver failure may require a liver transplant. Liver cancer. Cirrhosis increases the risk of liver cancer. Your doctor may recommend blood tests and ultrasound or another type of imaging test to check for liver cancer. Detecting cancer at an early stage improves the chances of a cure. Other complications. In addition to harming the liver, excess iron can harm other parts of the body, including the joints, pancreas, heart, and gonads. This damage may result in arthritis, diabetes, heart failure, loss of interest in sex and erectile dysfunction, as damaged iron reduces sex hormone levels. What causes hemochromatosis? Primary hemochromatosis. Mutations in genes that control how the body absorbs iron cause primary hemochromatosis. The most common mutations are in the HFE genes and are called C282Y and H63D. The important HFE mutations are autosomal recessive, meaning that a person must inherit 2 copies of the HFE gene with the mutation to have hemochromatosis. The most common pattern in primary hemochromatosis occurs with 2 copies of C282Y. 2 copies of C282Y are present in about 85 to 90% of cases of primary hemochromatosis. A less common pattern that leads to milder iron overload is caused by having 1 copy of C282Y and 1 of H63D. Mutations in other genes that control how the body manages iron levels cause 10 to 15% of cases of primary hemochromatosis. These rare forms are called non-HFE hemochromatosis. The most severe forms of non-HFE hemochromatosis are due to mutations in the HJV genes or the HAMP genes. People with these mutations develop symptoms and complications at a young age, and may have cirrhosis and other complications from iron overload by their teenage years. Secondary hemochromatosis. Secondary hemochromatosis is caused by excessive iron in the diet or from multiple blood transfusions. The usual cause of secondary hemochromatosis is blood transfusions given for severe types of anemia, such as sickle cell disease or thalassemias. In addition, people with bone marrow failure and severe anemia may require regular blood transfusions given over months or years. Red blood cells are a rich source of iron, and red blood cells given by transfusions can lead to a buildup of iron to high levels. The body does not have a good way to get rid of iron. In the past, iron overload was a common problem in people with kidney failure. However, the use of erythropoietin, EPO, to treat anemia in chronic kidney disease in people with kidney failure has lessened the chance of iron overload. EPO helps the body make red blood cells, lowering levels of stored iron and reducing the need for blood transfusions. Iron overload in the liver also occurs in persons with severe liver disease, such as cirrhosis due to alcoholic liver disease, or advanced forms of chronic hepatitis B or C. In these situations, the level of iron is high enough to worsen the underlying liver disease. Iron overload from excess iron in the diet is very rare, but may be due to cooking and brewing wine in crude iron pots and pans. Drinking alcohol in this situation leads to an increase in the absorption of iron and can cause serious iron overload in the liver. Neonatal hemochromatosis. Neonatal hemochromatosis is a very rare disease that leads to cirrhosis and liver failure in newborns. In most cases, neonatal hemochromatosis occurs when a pregnant woman's immune system produces antibodies that damage the liver of a fetus, causing iron overload. A woman who has 1 child with neonatal hemochromatosis is at risk for having a 2nd or 3rd affected newborn. Doctors can treat women during future pregnancies to help prevent neonatal hemochromatosis. Symptoms of hemochromatosis. With the buildup of harmful levels of iron, hemochromatosis can cause symptoms including feeling tired or weak, pain in the joints, particularly in the knees and hands, loss of interest in sex or erectile dysfunction, pain in the abdomen over the liver, darkening of skin color, which may appear gray, metallic, or bronze. With more severe iron overload, people may develop signs and symptoms of complications, such as cirrhosis, diabetes, or heart failure. Not everyone with hemochromatosis has symptoms. And hemochromatosis may not cause symptoms for many years. Symptoms typically begin after age 40, and, on average, women develop symptoms about 10 years later than men do. Prevent hemochromatosis. You can't prevent inheriting the gene mutations that cause primary hemochromatosis. However, early diagnosis is important since early treatment with phlebotomy can prevent complications of iron overload caused by these gene mutations. If you have a close relative, a parent, brother or sister, or child, with hemochromatosis, you should be checked for hemochromatosis. Talk with your doctor about testing you and your family members. Secondary hemochromatosis due to blood transfusion cannot be prevented easily. However, doctors can check iron levels and start treatment with chelating agents early, before iron overload causes damage to the liver, joints, and other organs. If doctors know a pregnant woman is at risk for having an infant with neonatal hemochromatosis due to a family history of the condition, doctors can treat the pregnant woman with IV immunoglobulin to lower the chance that the newborn will have severe iron overload. Treatment of hemochromatosis. In most cases, doctors treat hemochromatosis with phlebotomy, or drawing about a pint of blood at a time, on a regular schedule. This is the most direct and safe way to lower body stores of iron. Treatment of hemochromatosis can improve symptoms and prevent complications. Phlebotomy. Phlebotomy removes extra iron from your blood. Phlebotomy is simple, inexpensive, and safe. How much blood is drawn and how often depends on your iron levels. Doctors usually start by having a pint of blood drawn once or twice a week for several months. Doctors will order regular blood tests to check iron and ferritin levels. Phlebotomy is usually done in blood banks just like routine blood donation. In some cases, blood drawn from people with hemochromatosis may be donated and used in people who need blood transfusions. After phlebotomy has removed extra iron and blood levels of iron and ferritin return to normal, doctors will reduce phlebotomies to once every 1 to 3 months and eventually to 2 to 3 times a year. Doctors will continue to order regular blood tests to check iron and ferritin levels. Other treatments. People who receive blood transfusions to treat certain types of anemia and develop secondary hemochromatosis cannot have phlebotomy to lower their iron levels. To treat secondary hemochromatosis in these people, doctors prescribe medicines called chelating agents that bind to iron and allow it to pass from the body in urine. Chelating agents may be pills taken by mouth or intravenous, IV, medicines. And they do not remove iron as effectively as phlebotomy. Doctors treat neonatal hemochromatosis in newborns with exchange transfusions, removing blood and replacing it with donor blood, and IV immunoglobulin, a solution of antibodies from healthy people. These treatments do not always work to reverse severe liver damage, and a liver transplant may be needed. Often the newborn's mother or father can serve as a living liver donor. Only a small part of the adult donor liver is needed for transplantation into a newborn. How to treat the complications of hemochromatosis. Phlebotomy can prevent the complications of hemochromatosis. For people who already have complications, such as cirrhosis, liver failure, or liver cancer, when they are diagnosed with hemochromatosis, phlebotomy may not be able to restore health. Doctors can treat many complications of cirrhosis with medicines, minor medical procedures, and surgery. People with liver failure or liver cancer usually need a liver transplant to restore health. Eating, diet, and nutrition for hemochromatosis. What to eat. If you have hemochromatosis, you should eat a healthy, well-balanced diet. Talk with your doctor, a dietitian, or a nutritionist about healthy eating. What to avoid. Your doctor may recommend avoiding raw or undercooked shellfish, which can cause a serious infection in people with liver disease. Supplements that contain iron. Supplements that contain vitamin C, which can increase the body's absorption of iron. Talk with your doctor before using dietary supplements, such as vitamins, or any complementary or alternative medicines, such as herbal or botanical medicines. Dietary and herbal supplements are usually safe, but some may contain high levels of iron or unsafe chemical or herbal products. If you have hemochromatosis and don't have cirrhosis, your doctor may recommend limiting the amount of alcohol you drink to help prevent liver damage. If you have cirrhosis, you should stop drinking alcohol completely. Most people with hemochromatosis do not need to change their diet to eat less iron. Diet changes have a relatively small effect on iron levels, compared to the much larger effect of removing iron during phlebotomy treatment. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.